Welcome to the Birmingham Medical News Podcast. Today, we're going to be talking to a pair of clinicians about diabetes health. But before we do that, just to tell you about us, the Birmingham Medical News, we founded the Birmingham Medical News 21 years ago. It is a monthly newspaper for healthcare providers in Alabama. We mail the paper to a little over 12,000 doctors, nurses, practice administrators, ancillary providers. And we also send it by email, a digital version, to another 8,000 folks or so. So if you're interested in subscribing, you do not have to be a doctor to subscribe. There's no cost if you want to subscribe to our digital issue. You can just go to our website, birminghammedicalnews.com, and there is a place to sign up for a subscription. Now, we do this podcast at the studios of Cullman Company. We do it in conjunction with them. Cullman Company is a 100-year-old accounting firm based in Birmingham. They provide, a wide array of accounting services, from basic personal and business accounting to wealth management, and they also have a healthcare consulting practice as well, which is how we are connected with Cullman. Anyway, our sponsor today is TriVision. TriVision is the largest vision care practice in Central Alabama with 11 locations, and they have 13 optometrists and 11 MDs. Now, the reason that TriVision is sponsoring this podcast is there is a link between diabetes and eye care. Diabetes can quietly damage your eyes long before you notice. High blood sugar can injure the blood vessels in your retina, which can lead to diabetic retinopathy. And that's one of the leading causes of preventable blindness. The important thing is this doesn't have to happen if you get to it early. And TriVision uses advanced imaging to catch early changes that could lead to vision loss from diabetic retinopathy or glaucoma. So people with diabetes are twice as likely to develop eye diseases. But eye exams, regular annual eye exams, can stop the damage before it starts. So if you're interested, there you could go to their website, TriVision, TriVision. You can also call, it's 833, and then they actually spell out the word S-E-E, TRIA, T-R-I-A. Now, we're talking today with two certified nurse practitioners from the Cullman Diabetic Center. We've got on, you might stick up your hand so we'll know which one, but Morgan, I'm sorry, Morgan McHugh. I'm sorry. I was going to say McHugh or so. Sorry. And Alicia Lee. So, all right, guys. Well, first off, tell me, I don't know the size of the team at your practice, what everybody does. Tell us a little bit about that, what y'all do and what everybody's role is.
So at the Diabetes Center, we have myself and Alicia work alongside the Diabetes Center as some of the providers. So we see the diabetic patients in the clinic. Of course, Dr. Harrison, Adam Harrison, he is our medical director. Mm-hmm. And so he kind of oversees and collaborates with us. Okay. And then we actually have a registered dietitian, Debbie Morrison, as well as a LPN and certified insulin pump trainer, Nikki Hooker, that work through our center. We all kind of work together and kind of work one-on-one with patients in different ways. We do a lot of education classes there at the center. Debbie Morrison, the dietitian, she teaches a class kind of focused in on nutrition. We do a diabetic overview class as well. And we're looking to add some more just about different things, medications and other things like that.
Relatively new. When did y'all start it?
Yes. It's been about a year now.
Okay.
We just had the grand opening
In November.
November? Yeah.
Yep.
Okay.
November.
Okay. And let me ask y'all this now, and this is something I learned in just getting ready for this. It's totally new to me, but I understand y'all have what's called a diabetes self-management education and support program. Y'all tell me how that works.
So the diabetes management and education support is a evidence-based system that shows to improve the patient outcomes for their diabetes management. We are here to teach them the education that they need and give them the resources in order to help them as a patient by themselves or with their family members and friends really focus on their diabetes control. In order to have this type of program and be able to offer it to patients, we are ADA accredited also. So then we're able to have that benefit and show that we've meet reaccreditation and accreditation standards.
And I know ADA accreditation is the American Diabetes Association. What does the ADA accreditation mean for patients?
What it means for patients is that we have a certain standards that we have been able to accomplish. And for patients, they can have the trust in us that we are providing them with evidence-based practice to support their improvement in their diabetes outcomes.
Okay. And also, when you get to a diabetes self, education and support program, so I understand. Well, can you tell us a little bit about just what the program entails? Like when a patient comes in for the first time, and if you take us through that.
So actually the program, a patient can be referred to our program from their own primary care doctor. Or if we see the patient in the clinic, a lot of times we will recommend that a patient goes through the DSMES program. Initially, when they come in for the program, they will meet one-on-one with one of the diabetic educators. They kind of get a little bit of a history. They do a diabetes overview. They set goals that are obtainable for the patient, so kind of something that whether it be they want to lower their A1C level by, 1%, or they want to work on increasing their exercise. But they focus on making the goals attainable for the patient and just kind of helping to get them motivated and giving them more resources. From there are additional classes that they can attend and kind of get more focused on nutrition and just understanding what diabetes is and the better ways to manage it.
And I'm thinking, like, for example, nutrition. I'm thinking you could have a course, teach somebody, but then it's going to kind of be important that they stick with it. Do y'all do something to kind of keep it ongoing? I mean, to make,
We do also do follow-ups. So in order to eventually become reaccredited, we have to show that these patients met their goals. So if they had a goal of reducing the amount of carbs or sweets, or even just a simple one as I'm going to get rid of carbonated beverages, regular carbonated beverages, we can set those standards to show that they met those goals.
Well, that's interesting. So to stay accredited, you've got to show that people are reaching their goals. That's interesting. So obviously y'all got to keep track. I mean, and you may not know the answer to this, but I'm wondering if you've kind of kept track of around just ballparkish what percentage of patients reach their goals. And y'all might, if y'all don't know, it's okay.
But we have had several patients be very successful through the programs. I have had patients that wanted to avoid starting insulin, and they did the program, and they were very motivated and made a lot of the changes and took what they learned, and they were able to do that and very well, keep their diabetes maintained.
And you mentioned motivation. That makes sense. You gotta be, if somebody's not motivated, it's, you can't sort of, you can lead a horse to water, but you can't make them drink, so.
And it's that support factor also. These patients now have someone who specializes in this area to provide them. So if they are struggling, we want them to reach out and let us know. We're here to help them and guide them through those hard times, the complicating factors that may arise, or the transition in their life that may happen that require changes.
Are most of the people that come to y'all pre-diabetic, or are there folks who have been diabetic for quite a while? How does that, and again, that may be just kind of a guesstimate.
Mix.
Yeah, I would say it's a mixture. We do have several patients that are pre-diabetic. We have a lot of patients that are newly diagnosed and just kind of really wanting to learn about diabetes and how they can manage it. And then we have some that have struggled controlling their diabetes for, years, and they're just kind of wanting to really, now that we're here, they've expressed that they're just excited because they can, learn more. And
because they probably wouldn't have even heard a program like this until, recently. Are y'all getting folks? Like, what area are you getting folks from? I imagine not just Cullman, right?
Oh no, they're coming from all over right now.
Okay.
Let's see, Arab and Huntsville, and
we've had a couple from closer to Birmingham.
Because it's a function of people knowing about it, really. Well, let me ask you all this. I read that research showed that these, diabetes self-management programs can actually reduce A1C as much as metformin, which everybody knows is, of course, a diabetes drug. Y'all got any comments on that? That's kind of interesting. I mean, why would education be as powerful as metformin?
Knowledge is power. When people understand what the foods are doing to their body, or how exercise can burn off extra, you're giving them the resources that they are able to do by themselves and not solely rely on a provider just for prescriptions. And these are things that at your house you can do.
Right. And it's interesting when you mention food, that kind of makes sense because, I wonder, and y'all may not know the answer to this, I mean, going back to when we really started fast food, that would be the late 60s, I wonder if diabetes, I bet it's gone up since then. I don't know, but it would sure make sense because so many people's diet is so bad. I mean, if you eat at McDonald's or some kind of fast food 3 or 4 or 5 times a week, and plus you're drinking, Cokes all day, that wouldn't have been the case back before the 1960s.
And also think of just how our lifestyles are now. We are busy individuals. We have so many things to do. As both of us as mothers and wives, we're rushing to get home to kids and to make sure everything is taken care of in our house.
Right.
So sometimes the convenience of those foods is what's gotten us.
I can totally see that. Totally see that. I mean,
when we're able to teach these patients, but look, here's some simple things to do to make your life easier. You achieve your goals.
I can totally see that with the food, though, because you got both spouses working, so you're getting home maybe 5:30 or later, and then it's tough to get home that late and then cook a meal. It's much easier just to grab something. So that makes a lot of sense.
Yeah.
So what about, have y'all noticed any kind of category of patients that benefit the most from the self-management and education program? Is that
all patients that have diabetes are tremendously beneficial to this program.
Okay.
The ADA talks about the 4 critical times to refer or to try to have your patients do a DSMES program.
Okay.
This would include at diagnosis, of course, you're fresh. We need to make sure you are ready to handle this and tackle it in slow itty bits and pieces as we go along annually, because our standards change every single year.
Okay.
With the most recent evidence that's coming out or technology that's coming out. The third one would be when complicating factors arrive. So maybe you've now had a new diagnosis of the chronic kidney disease or the eye disease, like you even talked about. This is where we may need to relook at what your plan is and how are we doing. And then the 4th stage, the critical time, is transitions of care. So maybe all of a sudden your spouse has passed away. So how are we about to handle that if they took care of your medicines for you?
Oh, somebody that was helping you with your medicines, you mean?
Yeah.
Okay.
Yeah.
Okay.
And what if they passed away now? So how are we going to help you with that transition of care?
Yeah.
Maybe we have that 18 or 19-year-old also that's transitioning out of pediatric care into the adult section now.
Okay.
This is a huge change for them, more responsibilities now.
Yeah.
That transition of care in those timeframes.
Yeah, that makes a lot of sense. Is there anything that the diabetes self-management programs do to sort of address, kind of emotional or social things that patients with diabetes may experience?
So with the DSMES program, we really harbor on the 7 self-care behaviors, learning to problem solve, figure out where your problem lies out, how to address it. We're focusing on the healthy eating. How are you taking your medicines? Are we taking them the right way, the right times of the day? Are we having any problems with them that we need to just reassess?
Okay.
We're reducing risk, so of those additional complications. We're teaching you the monitoring, how to check the blood sugars, healthy coping, because there is diabetes distress with this type of diagnosis. And then also just teaching them about being active for that, emotional also.
Okay. Well, is there anything that I missed that we should bring up? Any question or any idea that I haven't really gotten to?
Yeah, and I don't know that I mentioned it before, but some of the classes are actually like in the group setting. So that is, also sometimes like comforting and encouraging for patients to, talk to other people with, the same or similar diagnosis, talk about what works for one and the other. And so it's kind of just a good, camaraderie almost.
Yeah, I would think a group setting would be a really big help, just the feeling that you're not alone.
Yeah, absolutely.
Yeah. Well, that sounds good. I appreciate it. I don't want to miss anything. You feel like if we've covered it, is there anything we hadn't covered we should?
I think we're good. Yeah.
Okay. Well, let's see here. Do y'all have a website? Or is it a website?
We do, yes.
Okay. We'll put the website, we'll just put the address of the website on the end of the video. So if anybody, needs, they can call.
Yeah, so the website is CullmanDiabetesCenter.com.
Okay. Sounds good.
And there's a form, if patients or anyone is interested in attending the classes that they can fill out and submit.
Okay. Sounds great. Well, thank you all a lot for helping us today. And I think it's great that we can at least improve, symptoms, I guess, or of diabetes with some of our, doing some things ourselves. And I think that kind of, I think that would help people emotionally too, because if you feel like you're kind of a little bit in control, so I think it's great, and I wish you all the best of success moving forward.
Thank you very much.
Absolutely, thank y'all. Thanks for coming.
Thank you for listening to today's episode of the Ask the Doctor podcast, brought to you by the Birmingham Medical News and Kassouf & Company. Please make sure to like and subscribe, and make sure to tune in for our next installment. I'm Steve Spencer, and wish you and your loved ones a healthy journey until we see each other again.